Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is for the shoulder. It is Yergason's test. This test came from a paper in 1931 by Dr. Robert Yergason. And in that original paper, he had somebody that came in with an anterior shoulder pain. He performed a resisted supination of the forearm while it was in pronation, and it produced pain in the shoulder. This test is commonly known to be utilized for detecting a slap lesion, issues with the proximal bicep tendon, or ruptures in the transverse humeral ligament. Now, there's a bit of a discrepancy in how to perform this test, which I will talk about here in just a moment. But the first way that I was taught is that you have somebody, sitting or standing. Mateo prefers to stand. You have the person bend their elbow, shoulder at neutral, and their forearm is in this pronated position. And what you tell them to do is to push out and supinate their hand, and you resist it. And if it produces pain, it is a positive. I was taught a second way, and I've showed this to people, that you are next to the person, you reach under their arm, gripping the wrist area, and then you just tell them, what I want you to do is to turn out your hand, turn your hand over as you come out like this. And while you're in this position, they're turning out, and you can more easily resist them as they are doing it. And again, a positive is pain in the shoulder. Now, there was another systematic review done by Robert Pettis, and he looked at the variation in how the test was performed, because in the original paper there was no description of what they actually did. So there was no talk about what the shoulder did. Was it an isometric? Did you resist them through it? And he just said, there was no description, no pictures, anything like this. And there are several studies in his systematic review in which he goes over this, where there are some of the studies that talk about movement of the shoulder, some don't talk about it, some of them do the isometric movement, some of them resist through the movements, things like that. And he concludes that this is why there's no real good sensitivity or specificity for determining an issue with the transverse humeral ligament. However, this test does have pretty good sensitivity and specificity for detecting slap lesions. So it is something that is used pretty commonly. If you look at the research, it says for slap lesions, it's pretty good. But for the detection of issues with the transverse humeral ligament, it's not that good. And I will say, and I forgot this a moment ago, they said a positive for an issue with the transverse humeral ligament is a popping or clicking or something up through here as you pull across. And likewise, again, if it hurts as it comes across, it could be an issue with the proximal biceps tendon. Now, with that all being said about the research, it is concluded very often in the papers that you look at that this test is best performed with a cluster, so things like speeds or compression tests along those things, and very, very importantly, a good patient's history and looking at the signs and symptoms and things like that. Seems to be a very common thing of saying that yes, you can utilize these tests, however, get that good history from your patient. So there you go. That's a little background about Yergason's test for the shoulder. So let me know, do you use it? How do you do it? Do you do any of the variations? Do you do an isometric? Do you move them through the motion? What do you do? Share about that down in the comments below. So, as Mateo always says, take care of yourself, take care of your patients. We'll see you next time.